Darby, can you hear me? Darby? Can you hear me, Darby? Darby, can you hear me? Darby, if you could just text me and let me know if you can hear me. Darby? Can you hear me, Darby? Yeah, hi.
Can you see
Yep,
me?
I can see you just fine. All right.
Yay, I was on twice and it kept knocking me off. I
Interesting,
couldn't figure
interesting,
out.
interesting. Now, can your the viewers see this?
I'm sharing it to all my people now.
Okay, so
let's
this
see.
is wonderful.
It might work. Let's
Yes,
see.
yes.
Yay. It seemed to knock me off a couple times. I don't know what that was about. Anyway, yay. Okay,
Okay.
we figured it
Can
out
everyone
finally.
hear us? I see we're adding on more and more guests, so that's very good. And finally, we did connect, so I'm very happy. And thanks for your persistence,
It must.
Darby.
Yeah, well, it must have been a technical difficulty on my end because we went live for you. I can't see your whole face right now, but I can see from your nose down.
Okay, how about like right now? Can you see me?
Now I can see you.
Got it.
Yes.
Okay.
Hi, everybody.
All right.
You guys are the best. Thank you so much for being so patient with us. All right, Dr. Khan, I can only see your nose again.
All right. How about right now? Because
face.
I see like my entire face is showing. Okay. All right.
Now I can see you.
Got it. So I'm just going to hold it as is. Okay.
Okay, great. Well, thank you guys so much for joining us. I'm really hoping that we can save this video. Oh, no.
What happened?
It knocked me off. I don't know.
Okay.
Oh, my gosh. Give me a break.
Can you see me? Can you see me, Darby? Can you hear me? Can everyone hear me? I can actually hear you.
Okay.
Yes.
You can?
Yes.
Okay, good.
Yes.
So that's weird. Okay. acting really weird. I'm just going to talk and hope it didn't knock me off. Okay.
Sure. So I can actually hear you. I can see you just well. And so we can go ahead and get started. Hopefully we can record this and play it for the everyone. If you wish, Darby, that you want to have someone else kind of monitor it for next time, so we can get actually live questions and answers, because I find that it is the gist of the whole Facebook Live, so that we can answer the audience's questions.
They must be having some technical difficulties today.
Sure. So I see that there are members that have come on, and I think this is working, and we can certainly continue if that's okay with you.
Sounds good to me. I've got something funny going on my end, but if everyone can see me okay, then I'm just gonna talk to you about this. Okay.
Sure.
So today we were hoping, today we're talking with board certified plastic surgeon, Dr. Khan. He spent a lot of wonderful time with us here in the past, and this is just another wonderful video. Finally, Facebook brought back the ability to have interviews with two people, and I'm just gonna assume that all of these technical difficulties are for that reason. So we have a lot of members who have been asking me about a few things specifically, and I thought this would be a wonderful time to chat with you. Lymph stuck in the silicone is something that keeps coming up because women don't know, should they get surgery for that? How do they detox that out of their lymph nodes? And that is something that is beyond my expertise. I have no clue. And I was hoping that you might have some answers for that.
Sure. So that's a very good question. I get this asked a lot. Now, the lymph nodes are up in the axilla, all the way up away from where the breast tissue is. And this is the basin, if you will, that drains all the lymph nodes and all the inflammation, whatnot else that occurs, including what is the silicone. Now, let's look at the hard evidence. Let's look at proof that this is what it is. Now, this one paper out of the Netherlands, out of 2006, that I posted on my Facebook, Dr. Khanplasticsurgery, and also on the breast implant illness support group, and I'll be more than happy to share with you. What they did was they did electron microscopy, number one, and number two, what they did was energy dispersive X-rays, which is hard evidence that looks at the proof that this is indeed what is consistent with silica. And lo and behold, on this one autopsy, where they looked at not only the lymph nodes, but also nervous tissue, nerve tissue, they also looked at connective tissue, amongst the many others, and the many autopsy specimens that they looked at organs, including the brain. They concluded that this was indeed what was silicone. No questions asked, because this is concrete, hard evidence looking at what is the energy dispersive X-rays. So this is a way that they were able to quantify and conclude that this is indeed what was the silica present, not only within the lymph nodes, but also within the brain matter. And so that's why they were able to say in this young lady in her 50s that she had the gel bleed from the silicone, and that it dispersed not only around in the periphery to the lymph node, but elsewhere. And she was known to have a rupture of the implants, given the history, physical exam, and also the imaging workup prior. So going back to, yes.
So I have a question about that.
Yes.
How were her symptoms compared to other women?
So she had all the signs, symptoms of BII, breast implant illness, to the point where she actually dedicated her body so that she would ultimately have her body be autopsied so that it would further enhance science. So, and this is a
paper. So she passed away.
Yes, she passed away, unfortunately. And she had dedicated her body so that she would have had her studies be done so that they could further enhance the quality of life. And this is the paper that was published out of the Netherlands. Now, this is one exact concrete proof where a group of researchers actually got together and they concluded this definitively. Because anything else we say is going to be speculative or not substantially proven. And we're looking at, as a physician, as an MD, as a board certified plastic surgeon, we want hard evidence because we need to go by that. Now, I also know this, if you look at the breast implant capsules that I have removed from the many patients, you see giant cell reactions, you see histiocytic reactions, again, all consistent with what are the body trying to fight off the breast implant, such that it basically
Trying to
walls
expel it.
exactly in order. And this is like the body's defense mechanism, you know, the white blood cells, the macrophages, if you will, that basically are trying their level best in order to fight this. Now, what has happened also,
Wow.
this is hard evidence where a lady went to her breast surgeon. She looked at what was a notable mass in the proximity of the implant, and that prompted a biopsy because there was concern for breast cancer. Lo and behold, that biopsy comes back and says, now this is me looking at the path report from the pathologist, this is a giant cell reaction, which basically means that the body is trying to recognize that there was a local and focal bleed. And so the body recognized this as foreign and hence was trying to fight this. And believe it or not, you know what was the conclusion of the breast surgeon? And again, at a reputable hospital here in the Detroit area, the Beaumont Hospital specifically, and the breast surgeon, she concluded you need to get your implants out because this is what you're having, a reaction to your implants. Now, what could be more hard? Now, what I'm going to do is I'm going to rummage through my set of patients consultations that I've done, and I'm going to actually post that as well so that the patients can see that the body itself is giving check engine light warning signs saying that, you know, there is a problem going on, because this is the hard evidence I as a physician look at. Now, for example, and I've said this in my consultations, for example, if I'm shaving and I cut myself, what happens is that if I do get a cut, the lymph nodes in the neck, the anterior and the posterior triangle are going to light up because there is an inflammation. And this is the body's defense mechanism where the white blood cells come and they basically, all of a sudden, just like an army would, try to stop and basically prevent this infection from spreading. And that's why everything is contained. Same thing on the chest. If there is a lymph node that is reactive, it's because there is inflammation. And we all know that there is inflammation around the implants because the body itself recognizes it, because you see most of the ladies will see and attest to the fact that they have dilated, engorged veins on their breast tissue in and around the axilla. And then they have pain in the
I certainly did.
Yes. So you can see.
And not only that, a lot of women are having heart issues, and we've talked about that a lot. I mean, personally, I was in the emergency room 3 times. I thought I was having heart attack.
So can you tell me what were your symptoms like when you went, and what was the diagnosis?
Sure. Every time it was shooting pains down the left arm. I lost the ability to use my left arm. I mean, I couldn't breathe. I'd get really tired. It was everything that a woman would have for a heart attack. It was everything.
Sure.
One time I was breastfeeding my daughter and I had all these shooting pains and I lost all control in my arm. Luckily I was sitting on the bed, but I dropped her out of my arm and I had no feeling of breath. You know, my breath was completely contracted and I had severe anxiety and heart palpitations. It was scary. It happened 3 different times, and I'd get an EKG, and every time they looked at me like I was nuts.
Got it. No, the reason is because the last guest that I had almost a couple of weeks ago was a cardiologist who came on and said that, you know, breast implants certainly do trigger vasculitis, inflammation in and around the cardiovascular system, and hence the blood pressure that the ladies get. And the lady that I did earlier this week, just 4 days ago, she actually had the severe pulmonary hypertension. And the entire extensive workup that was done on this 39-year-old led to essentially the implants being the culprit. And we will see how. So I did her surgery 4 days ago, and she had a severe pulmonary hypertension. Her hypertension in her lungs was almost twice the upper limit of normal. And so we will see how, you know, over the next several weeks that she recovers, and, you know, there will be a before and after. And again, going back to what you just mentioned, you know, she had all the signs and symptoms of the vasculitis. And so the inflammation occurs in the chest. And so to answer your question, what happens is the lymph nodes do light up as a result because the entire body is trying to protect, especially in the periphery. And so I find, you know, again, from the patients who have had a successful removal of the implants, that their axillary pain that they have is essentially gone after removal of the implants plus the capsule, because that inflammation is being taken away. Now, as you will see,
Absolutely. I never had another heart issue after that. Never.
right,
And
right.
I removed mine almost 3 years, a little over 3 years ago.
Sure. So now the question becomes, as a plastic surgeon, should I go ahead and pursue all those lymph nodes? Absolutely not. I would consider that malpractice, because if I go in and start removing those lymph nodes, which are indeed very much reactive, I'm going to go ahead and potentially cause lymphedema slash basically compound the picture even more, where now the patient may have problems in the upper extremity, for example. You know, the ladies who get mastectomy, who have stage 3 or 4 breast cancer, who have the axillary lymph nodes dissected, what do they end up getting? In the upper extremity of the area where they get lymphedema, the swelling of the arm, they get predisposed to infections, they cannot move their hands regularly because the entire hand, arm gets puffy. So for the same reason,
Wow.
you know, it is what I would call malpractice to go in and remove those lymph nodes. Now, if the lymph nodes are palpable and there is a concern, one has to always keep in mind this might be breast cancer, because 1 out of 8 or 9 women are going to get breast cancer, and we don't want to naively attribute these palpable lymph nodes what may be potentially breast cancer. So sometimes it is warranted in indications where, if there is a concern, if there's a family history of breast cancer, just going in and biopsying one lymph node just to see kind of what exactly are we looking at. And this might be very much proper and very much indicated, because we see this a lot as not only plastic surgeons, but as general surgeons. Yes, yes. So for some reason, it was saying that,
You can.
now I'm back on again. So going back to the
Okay.
point of,
And I can't see any comments. Can everybody still see us in the comments? Can you see if anyone can, are they saying, can they see us okay? Because my screen is completely black. I can't see anything. So I don't know if it's just user error, but if you can see me and everyone can hear us, then I'm totally fine. I just wanted to make sure I'm still on with you.
so I'm getting, so I'm getting a feedback for yes. So I believe people
Everyone,
can
okay.
hear us.
I'm getting thumbs
Yeah,
up. Okay, good. Great.
got it.
Okay. I
Okay,
can't see any of the
sure.
comments because we're on live with you. So
Right.
back to the lymph really quick. I wanted to ask you a couple questions while they were still fresh in my pregnant lady brain, because they'll go away and be gone. Okay. So one is, doesn't, the body tries to fight off the silicone. I mean, the capsule is silicone, essentially, like not the
Correct.
capsule, but the surrounding, right? So even women that say, well, I have saline, you still have silicone in your body. And so but the women that are finding the silicone in their lymph nodes were women that had silicone. So my question about that is, A, silicone is highly toxic in the body anyway, it's trying to get rid of it. And B, I'm not suggesting that, it should be removed, but I'm asking, because how do we expel that from the body? Because it seems like it's such a tricky substance. And if it's pooled to a place where it's in lymph nodes, I mean, and not only that, we've talked before where you've said, that absolutely you can get breast cancer from this, and a lot of women get it from this even if they don't have history of breast cancer, because of the nature of the beast. So those are kind of my, this has been something that I've been wanting to talk to you about, because it does come up so often, and I feel so bad for these women that are stuck with this in their body, because they go to all this trouble to remove it from their breast tissue and it's still in the body, so it's still so highly toxic for them. And I don't know how to help, and I don't know how to answer that question.
Sure. So this is a good question to ask. What do we do with the residual silicone? And I will tell you,
Right.
this physically cannot be removed. Now, let me give you an example. I saw a lady, 26 years of age, a year ago. She actually, believe it or not, went to a local aesthetic group that actually ended up having silicone injected in her buttock area. Now, we hear about this in Florida and New York a lot. And so she actually had high-grade silicone injected as a chemical directly into her body. And she ended up coming to me where the silicone itself had not only, and I did a CT scan with contrast. And
did it migrate all over her body?
Exactly. So what happened was the silicone, because remember, its height, its density, it is dense.
Yeah.
And by gravity, what happened, and she had 100 injections on the right buttock area and right buttock area and the gluteal area above to enhance. And again, that was the intended purpose.
Oh my goodness.
Yes, and I will tell you, my heart, basically, I mean, and this we see a lot, unfortunately, where people who are not board certified plastic surgeons do this type of criminal behavior where they're basically doing this in their own setting and not licensed aesthetic providers, you know. And so what happened was, so I did a CTA, which is a CT angiogram to see basically what we were looking at. Lo and behold, you had not only the inflammation where the silicone was, but also in the periphery. And I told her, what do you want me to do? Should I get a liposuction and suck all of that out? It's only going to spread. Should I physically cut it out? I'm going to leave scars all over your legs and your upper buttock thigh area. Because what had happened was that silicone, because of gravity, essentially, as you can imagine, it's very dense. It migrated down into the thigh and the calf area. And she actually, believe it or not, these are her own words, had worms type feeling that were crawling in her legs. Now
my gosh.
she,
poor thing.
Yeah, and I will tell you, it was very disturbing to the point where what I did was I actually sent her to a radiologist with ultrasound guided biopsy of the fat / the area in the buttock and the thigh area to conclude. And guess what? The pathologist read this as foreign body reaction consistent with what is silica, because this is what was injected. Now I told her, I want you to go to the aesthetic doc who did this to you to tell me what exactly was the chemical. Where did she purchase the chemical, so that I find out if there's an antidote for it, because I need to know what the chemical was, because it was not, God knows, industrial grade. Believe it or not, it has been documented. Some of the patients who have gotten it in Florida have actually, the aesthetic clinician actually did go to Home Depot, believe it or not, and got the silicone from there and injected it.
No.
Yes. So believe it or not, and so basically I said,
wow.
As a biochemist, I said I need to know.
Because if you get your lips done and you get them too big, they have a dissolving fluid that you can get it.
Exactly.
You know,
you
but
have
that's
an enzyme.
This.
Yeah. So you have an enzyme. So very good thinking, Darby, on your end. So there is, if you inject so much hyaluronic acid, for example, you can get a hyaluronic acid enzyme that breaks it down such that you can correct the problem. Dissolves it. So basically you can, control it.
This was industrial grade, Dr.
Right. And we see this a lot.
How did they think that was okay?
So believe it or not, this is very common. I want my viewers to go ahead and Google, in silicone injection, and you will see a lot of reports.
Oh my, what a nightmare.
Especially in the Florida / New York area and elsewhere across the country, and not only in the US, but elsewhere in the world. This is what unfortunately is, because we see this as plastic surgeons. So believe it or not, so she came and I actually had her go get a biopsy of what she felt was a lump in her thigh area. And lo and behold, it came back consistent as silica, because this was a giant fault. And I told her, unfortunately, I cannot do anything for you, because the closest thing would be liposuction. And I said, I'm only going to disrupt the fat tissue because I have to suck that fat out, because that's the level where this was injected. And
so what can she do? She just has to live with this in her body?
I will tell you, I myself could not provide to her, and I wish there is an antidote, there is a solution, or there is a way that we can potentially remove without disrupting her body, because essentially, if you can imagine, that's a lot of tissue that would need to be removed. And we have a CT.
And she must be so ill. She's got to be so ill.
And I will tell you, so the same lady, unfortunately, right here in town at a major hospital, doc who is affiliated with the major hospital, she ended up going to a gastroenterologist, and she ended up getting liposuction under local for her tummy, and she had no signs, symptoms of any obesity, but she fell victim to this. And not only that, she had a set of implants that she was going to get removed by a doc for $700. And she was smart. And, and again, this is what, unfortunately, I get to hear and see in patients that go to non-board certified plastic surgery places. And this is replete. And, if you go down to Mexico / other countries in the neighboring area, this is where a lot of this is being practiced, unfortunately. And so basically she ended up, getting a set of implants that she wanted removed because she was having these BII type symptoms. And the point being here that she truly did get the removal of the implants, the whole end block technique. But guess what? She has got the rest of the silicone. And I will tell you, I myself cannot think of any smart way to remove this silicone in her buttocks / gluteal thigh region, which has migrated down now, that is causing her all this inflammation. Because if there is a plastic surgeon or a surgeon or a toxicologist or anyone who's listening who can help me understand, I will be more than happy to remove this, because I cannot
So
find.
the so this so so the answer really is, at this point, you just have to keep a healthy diet and do your natural detoxes and hope that
Right.
your body can expel this from your lymph nodes, maybe lymph massage and
No,
all
but
kinds of other
this is
things.
embedded, just like that, autopsy that was done on that Netherlands
Yeah.
group that's presented. And I'm going to go ahead and update my Facebook such that we can see it again. What and
Yeah.
how can this be removed from the brain matter? Because this is what they concluded. Now, this is me looking at that paper. It's a reputable paper from a very organized group, and they were very or basically organized in the way that they presented their paper, because I read between the lines, and it is a very real paper. It's not something that they're beating about bush and making up data.
Yeah,
This
it's
is
not
concrete evidence.
anecdotal.
Yeah,
Wow.
yeah, it is exactly. It is not, because it's hard
All
evidence.
right. Well, I
So
wish we
if
had
I
a better
just,
answer for that.
yeah, yeah. So what I would suggest is, and if I just may mention, I hear about one patient came in, and I ultimately get to hear a lot of uh, different modalities that are used by a lot of different people. Like one patient came in and she said she's starting to take charcoal in order to remove the silicone from her body. And I said, you go to the emergency room and you ask your emergency room doc, they normally use charcoal for patients who ingest, for example, a suicide attempt, but they took a lot of aspirin or Tylenol. You ingest
Yeah.
the charcoal that basically absorbs / clings on to the aspirin that's within the GI tract, so the body itself does not absorb it. So it's given in a timely fashion, again, all with an attempt so that it binds. Now, it is too late in the gut. It's not going
Charcoal has
to.
been instrumental, but charcoal has been instrumental for most of the women in my group. We're up to almost 8,000 women in my group, and many of them use charcoal for all the other chemicals and issues and have such wonderful results with such a cheap,
Now,
inexpensive thing, because, yeah,
yeah, so
it's
this I
amazing.
purposefully bring this up because I will tell you, with the charcoal absorb the silicone from the connective tissues and the
Yeah,
rest
that
of
one
the.
probably would not. Right. I get
Yeah,
it.
yeah, and you
Yeah.
see, the point is now there's there a placebo effect, because otherwise, if that's the case, then one might say, well, why don't you get dialyzed? Because that's going to remove, clean, basically clean the blood, because this is where all the impurities are floating the silicon. And I would say that's absolutely not,
Dialysis.
yeah, dialysis, and that certainly is not an answer either. Charcoal on my now, I'm not
Sure.
a
Well, and the
toxicologist.
charcoal helps with other chemicals. Yeah, but the other chemicals, because the women's bodies get so torn down and their immune systems get so that it leaves room for the liver doesn't detox properly, the parasites come in, all kinds of other issues. Someone asked a question, if you don't mind, Dr.
Sure.
Khan, I wanted to ask you. She said if she has the silicone, I'm guessing she's asking if it's in her lymph, would that cause a cyst on her liver? I would say probably. Your liver is your detox system, but we'll leave that to Dr. Khan.
So,
Could that give you a cyst on your liver if you're
so
trying
it
to
is.
detox silicone?
So it is very normal to get cysts in the liver. Just right now, there are many different types of cysts. You can get an amoebic cyst, right? You could get a cyst from an infection potentially, correct?
An amoebic cyst would mean it would be parasitic.
Parasitic, correct. So
Mm-hmm.
there's many reasons for cysts. Now, what needs to be done is, and I'm not the world expert on this, but I would suggest going to
Sure.
a GI hepatologist who basically will do an MRI, and who may end up starting off by
Check it
doing a
out.
CT scan with contrast, and again MRI, because they're different. The blood flows, getting ultimately a biopsy or following it. So as we do a lot of CT scans, and again, as a board certified general surgeon, we do see, but what do we normally do about it? Not much, unless they present with signs, symptoms of that may be potentially getting large, that may potentially be precancerous, maybe parasitic, maybe like a normal variant of the body reacting, or basically maybe a fatty liver, that these might be reactive,
Sure.
or cirrhotic liver, sometimes, and again, so there are many reasons for a cyst, but you cannot grade and say, well, if I've got silicone, I'm going to get cyst in the liver, and that's basically the silica. Unless it's biopsied and shown, maybe what I would say by not only the electron microscopy.
But toxins create cysts.
Absolutely,
yeah.
absolutely.
If your body is acid, if your body's more acid than alkaline, you get cysts, unfortunately. And a cyst in your liver only makes sense, and I would say absolutely that would make sense to me. And when your body is fighting off, when your immune system is so in overdrive because it's trying to fight off your implants or whatever else you have going on, it really weakens your immune system, which is why so many women in the breast implant illness group end up with severe parasitic infections and all kinds of autoimmune issues, because the body is in complete disarray. So I would say research that. That makes sense to me. Okay, Dr. Khan, I did want to move on to our next topic, because it's another thing that the women are really interested in, and me too. I'm curious. Talking about fat transfers, there's a lot of controversy coming up about them, because we're hearing that there's a lot of cons to fat transfers, and there's pros and cons, and we're trying to figure out another solution, really. Like, many of these women that are joining the group don't even have implants. They were just considering it, and now they don't want to have anything to do with implants. Sure. But they want to look better after breastfeeding.
Sure. No, that's a very good question. So let me go ahead and ask you, Darby, and I'm going to go ahead and put you on the spot, because you know the answers. You're very well read, and if you don't answer, I will answer.
Okay.
So fat. No, sorry. So, and again, I say this because you know what, this will provide for a positive learning, if you will. Okay, now because
sure, let's do it.
So one of the best areas of the body where you have the best perfused areas as far as systems is the face, correct?
Okay, yeah, sure.
So fat grafting to the face was a big thing that started 10, 15 years ago, where instead of Juvederm and all these other chemicals / agents that were injected to enhance the body's face, they said inject fat. That's natural, it's long lasting, and it's your own body's thing, and you don't have to keep doing it, because when it does take it takes beautifully.
It stays.
Okay. Now, the best perfusion of the entire body is on the face, around the nose. Whenever I do like the basal cell cancer on the nose, I never give the patient any antibiotics, or even like neck, chin, cheek, forehead.
So if you're taking something off for cancer around their nose,
I don't
you're grafting because of cancer. Got it. Okay.
Yeah, it's because if I'm doing like a skin excision, for example, if I'm working around the cartilage.
I'm just trying to make sure, because we don't all know all the
sure. No, but I will get it. No, I want to basically so basically I just want to kind of educate so if I do like I did a nose reconstruction, basal cell cancer of the nose, I brought ear cartilage and put it on the nose in order to that one I would definitely use antibiotics, because it's cartilage, the blood supply to the cartilage is
and my husband's grandpa just had a similar surgery. I know, that's why I know what that is. Otherwise, I probably wouldn't. So that's why I was clarifying.
So when we do fat grafting to the face, right, which has a robust blood supply, because you're going to take fat from the belly usually, or the thigh, usually from the belly, you spin it, what they call the Coleman technique. You take the good fat and the fat that is basically is going to be transferred, you centrifuge it, and then you take the fat and you inject it. The fat that's injected on the face, for example, in the best of the hands, which is a non-traumatic technique, do you know what percent, and this is a question for you, what percent of the fat actually dies that is injected onto the face? Because remember, when the fat is injected...
Is it 30%?
Right on, Darby, yep. So 30 to 40% of the fat. So good answer, very good. So you got an A for that. So 30 to 40% of the fat actually dies. Now this is the fat, and we're injecting like in a fanning type technique. You basically just like a web. You're injecting it like 1 cc, and you fan it out such that what you want is the fat that you inject that actually ends up taking, because the blood supply is there to support it, correct? so
Okay,
that
makes sense.
if you inject, let's say, 10 cc's on each side, you're going to find a whole lot more of it is going to be free floating right in the middle, and it's not going to get that blood supply that it needs despite the robust blood supply of the face, and a good part of it is going to die, and this is what we call fat necrosis. Correct?
Right. Now the question, yes. So
Yeah.
now the question about that is, okay, go ahead.
Got it.
Sorry.
Now let's go ahead and
You're getting there,
extrapolate.
I
Yeah,
think. I think
let's
you're getting there.
extrapolate that. And let's say, for example, we just did an explant and block, and then the entire capsule is removed, and we're happy. And there's that big
So what he's
void.
saying is you're putting 10 cc's in each side, and we're going to lose 30% of that, is what he's saying.
Correct.
So you've got breast tissue now that we've taken from another part of the body. We're putting 10%, we're 10 cc's in each side. 30% of that is going to be gone. So we're going to have about 7 cc's, maybe.
Right. And 7 cc's is
in each
nothing.
side.
Correct. 7 cc's is nothing. And number two, the
Very
blood
small
supply,
amount, right?
the blood supply is not
7 syringes.
Yeah, 7. And so you're looking at, normally you would want to do like 50, 70, 100, 150 cc's. And guess what? A good part of it is going to die. Now, guess what? And now you be the judge of this. Got it? So just imagine we're generous. We're going to do this, hypothetically speaking, 100 cc's. Got it?
Oh my goodness.
And 30 cc's of, and this is on the face. Now, I would say 30 to 50% might die now in the best of the hands, correct? And you've done the Coleman technique. And guess what? Next year, and 100 cc's is what? Almost a fourth of a Coke can, correct? It's not much. It's a very small volume.
Wow, yeah.
A Coke can is like 375 or so cc's.
So you're going to be really skinny everywhere else.
And then guess what? 30.
Get enough fat.
Yeah. So this 30%, 40%, 50% is going to die. Now that's going to lead to fat necrosis, potential fat infection. And guess what?
That's what I was asking.
Got it. And guess what? Next year, when you get your mammogram, when you have, what fat necrosis feels like? Heart lumps. And you have.
Well, that's what okay. So that's what I'm asking, is because some people were linking it to potential cancer issues.
Right. So what happens now is,
do you see that?
Now guess what? You have fat necrosis in an area or the proximity of the breast tissue, correct? Or if you go in and around, inject that fat in the name of vanity around, and you have a mammogram next year that shows fat necrosis, is it a precancer, cancer, calcified?
And you're having all these lumps in there.
Lumps, irregularities. And I will tell you, I would not recommend that, especially at the time of surgery, especially when the end block for me, and I consider when I board my patients for 4 hours, I'm not going to go ahead and do fat transfer, fat injections for something that I know 30, 40% will fail in the best of the situations. And why? Potentially, Jeff, now there, so one of my patients, for example, that I did work with when I was in training as a fellow, was a lady. She had a double mastectomy, so she has no more breast tissue. So chances of her theoretically getting breast cancer is 0%, correct? Because she came in, she got fat transfers and fat injections from her belly, serially 100 cc's, come back after 6 months, another 100 cc's, 100 cc's, 100 cc's. So now, even though 30% of it, 40% of it was dying, you cannot put a whole lot more than because otherwise it's just going to be free floating. It's going to die. It needs that blood supply, correct? And so what happened was, after 5 of those, she was able to develop enough of a mound that she could say, you know what, I got, quote, what I would say appearance of what breast is, when she would walk by a mirror and say, you know what, I have this resemblance. Now she could do that because she's not going to get a mammogram because she has the mastectomy done. So you answered the question, Darby, and I put you on the spot for that reason. If you're going to have 30, 40% of that, now have you seen the void in the big space in the chest after the explant is done and the end block is done? It's like a whole big pocket. People get scared when they look, wow, that's me, right on top of the ribs with all that space where you can actually, that's the area you're going to put. You can say with confidence that is a fat that's going to die almost 50%, if not more. And then unnecessarily lead to infection problems, fat necrosis, and later on.
And not only that, when you're telling me this, all I'm thinking is these women that are already, their body is already trying to heal, like I keep mentioning, and like I see every day I try to survey the women in my group, and one of the things is that they're not just the breast implant illness. the symptoms, it's not just the symptoms. They're not just having symptomatic issues that go away. What's happening now is, and as I've mentioned, is that their immune systems have been so compromised that it's allowed their liver to slow, so they're more toxic than they would be. They're having parasitic infections. They're having fungal infections. They're having, there's just so many things. They have yeast. They have candida, terrible yeast growth. All of these issues that the body would normally be able to fight off if it was healthy, but because it's been in such an inflammatory state, it can't do the normal detox issues. So my first thought is, and I'm not trying to poo-poo anybody who's got a fat transfer. I know a lot of women have, and they're happy with it, and that's not why I'm asking this. I'm asking this because a lot of women ask the question, and I've done some research and found what Dr. Khan, actually you're talking about, is exactly, obviously I've done some research on it, but is that I think about these women whose bodies are already dealing and trying to heal. If you put that issue, and now you've got the fat die off, and if they already have, if they're already teetering on cancer issues, do you know what I mean? It's just like you're just adding to that pile of toxic buildup and issues that your body's already trying to heal from. So you answered my question. And the question is really, it's up to you as the patient, as the consumer, it's your body, but what makes sense is that you have potential side effects and issues, and that all makes sense to me.
Sure.
Dr.
Now,
Khan,
yeah,
I appreciate that.
I just may mention something, I'm a big fan
Sure.
of DNT. Yeah. I'm a big fan of DNT. You know what DNT stands for?
That is?
Do not touch.
No.
and
Okay.
I say stay away from problems.
Yeah.
Guess what?
Sure.
You're not gonna.
I understand that. And we know your strong stance on doing a lift right after explant, and my whole group knows your stance on that.
Right now, I say no. I say this to you now. You can blindfold me. I promise you, I can do a lift. That's how easy it is. There's so many general surgeons are doing lifts. Dermatologists are attempting it. Now, I tell you, if you go in and around, and so people do these modified concentric, peri-areolar lifts. These are only transients. 3-5 years is how long. A true lift is the one when you do a lollipop / anchor incision, and that's the one that has
I had that. Yes.
Now, the bottom line is that's a lot of dissection around at the time of surgery, where 10-15 years from now, you're going to end up where you're going to be because of the gravity effect, unless you're on the moon. Now, I say this to everyone.
And if you've gotten pregnant twice, after explant like me, and you've breastfed 2 babies.
Right. And that's part of the recovery. And so I say to myself, I'm never going to get a facelift in my life. I'm a big fan of DNT. I'm never going to get a rhinoplasty. I have not done any Botox, 0. I want to do a real reconstruction. I want to help people. I respect every person unconditionally who wants to get Botox, but this is just my choice, my personality, where I say,
Sure.
I could do it in a heartbeat, make more money, but I say, I want to practice. This is who I am. I want to help with reconstruction.
And we so appreciate and respect you for that, Dr. Khan. And anyone who's met you always tells me what a huge heart you have and how much you believe in what women are going through with breast implant illness and how compassionate you are. That is the constant feedback I get about you.
No, thank you. And I will tell you,
kinds of stuff.
I will tell you, I put out another paper, if I may mention. This is important for everyone to see.
Sure,
we want, I can go by a hunch. I can go by anecdotal. You can too. I want hard evidence. Sure. I want autopsy reports.
And I appreciate
want pathology reports. That's why I change, and why I recommend every single plastic surgeon to change the scope of their practice. Look at the one thing that was public.
Well, if you could send me those, I would love to put them up in the group. I mean, men aren't allowed in our breast implant illness group, so you'll have to send it to me, or Lori can.
Sure.
One of your staff members is in our group.
Yeah, so there is a group out of Australia that basically published, if I'm not mistaken, it was out of Australia. They said, they followed 50 patients. They got the surgeries, the bloc total capsulectomies, and they asked each 50 of them and said, would you get an augmentation again if you were given, even for free, for example, would you do it? I will tell you, to date, not a single lady I've explanted who has had an explant or who has had done this in the past will not even mention the fact that they would even consider it. And if they were to be given a chance, they would never have done it. And if they were to be given a chance, they would have done it sooner. They would have bounced back sooner. This is a surgery where
Yeah,
a
I'm one
patient,
of those.
yeah.
I'm DT now. I don't want to mess with it, and I don't, I have small children, so I don't want to go under. I don't want to mess with it, and I'll tell you, so many women feel the same way. I
Right.
mean, there are people that feel differently, but yeah, I
Sure,
agree.
no, and we
And by the
respect it,
way,
and we respect that. And the point here I'm trying to make here is, it is not worth it. And I will mention many
sure.
reasons. Number one, not a single lady has, we're in life, we're going to vote for someone this year. We're going to go on, basically get a shoe or get a car or get a watch or go on vacation, whatever. We always will have a remorse about
Sure.
what we did wrong. And I've mentioned this, not a single lady has a remorse about explanting. And that tells you in
No,
itself.
I've never, absolutely.
And
Even
this
some of
tells,
the women that say they hate what their boobs look like, they say, I would do it over again in a second. I feel so amazing now. I look better. I mean, the
and
women, most of the women that get an explant, they look like 10 years younger within weeks. And
healthier,
I
yeah.
mean,
And the joints
yeah,
improved, their eyes
absolutely.
improved, and all of this improved. Everything improved.
Everything,
And I will tell you,
everything.
so the point I'm trying to make here is, this fact alone should be a reason where, plastic surgery has 3,000 procedures. My boss told me once, and look, not every single person regrets all those two, 1,999, but they never regret the explant procedure, because that in itself,
Yeah.
everyone is hurt. The implants only hurt. They have a time period of 7 to 10 years. They get all these problems of BII, among the anxieties and all these other problems. And I say, why do something and why take a chance unless you can guarantee that this
Yeah.
person is not going to get it? And I'll tell you, ultimately, all patients unfortunately become victims. Today, I got a call
Yes.
from, guess what? Who reached out to me from where? From Saudi Arabia. This lady,
Wow.
okay, you know what she told me? She said that the best plastic surgeon in her country cannot guarantee her an end block, and that she will be left with part of the capsule behind. I
You'd
reached,
be surprised how many doctors are doing that. And there's one in the area, which in in the area of BII, which I won't say any names, who is, I believe, ending up doing just capsulectomies. Why do I always say it wrong? But
partial
you know,
capsulectomy. Yeah, partial
yeah,
capsulectomy.
a capsulectomy. He's doing that instead of the en bloc, and I think it's because he can do them quicker.
Right, right.
And honestly, I mean, I wouldn't say any names, but all I have to say is that so many women have told me they've ended up without their en bloc, and a lot of women that aren't getting the proper surgery are still having a lot of symptoms, and that breaks my heart. And I don't, you want to believe that that's not on purpose. You want to believe that that's not on purpose because it's easier, and that's all I'm going to say about that. But
I will expand on
and it,
that. It is always easy when you're in the OR and you're tired and you have another patient or two waiting and you have to go home and whatever it may be. There's the whole commitment and the cure and the relief lies in the fact that the entire capsule needs to be removed 100% with sincerity
right.
from the bottom of the heart. And the only group of people who can do that are the docs who are only explanting and not implanting, because then you're not a believer in BII. And so I told that lady from Saudi Arabia, listen, you're going to be, so yesterday, or day before yesterday, I took a phone call from a lady from Illinois. She actually had her the explant surgery done on the 20th of February, 2020. We're going to get an
Wow.
MRI from basically to show that, there is no residual capsule. I have asked the patient to find out what the operative time was. Another lady out of Arizona reached out to me and I asked her what was the operative time. She was told that her end block was done right and left in 1.5 hours. I said that right off the bat is
Yikes.
so you said it
That's
yourself. See,
scary.
so 1.5 hours an end block, and I said that is the big red question mark, because the last thing I want to do is to have her come here. And she said, you know what? I'm a young lady. I fly the world. I'm an entrepreneur, and I have the same symptoms as I did before the explant, and I would hope that at least they would be
Poor thing.
somewhat improved. And she said, if anything, they were worse. I told her, listen, I have nothing to. She showed me
That breaks
pictures.
my heart.
And this is what I told the lady in Saudi Arabia, and hopefully she's listening. And I said, listen, you don't want to be in a situation where you undergo the surgery, knowing that your plastic surgeon is not going to do a complete job, and then you're going to seek another surgery because your plastic surgeon felt uncomfortable or was not trained or did not believe in BII. And so that's why I say it's crucial and critical for you to find the right surgeon who will offer you the surgery that you very much need. Now, I saw the operative note of this plastic surgeon, and you know what it said? He exchanged en bloc with a total capsulectomy, and on one side he said, I did a capsulectomy. If you look, when the COVID-19 vaccine does come out, do you know how much they're going to inject in me and you and everyone else who's listening?
None.
A CC.
They're going to inject nothing in me.
That was a joke. Okay. But the point is, they're going to inject a CC and a half only, because that's enough to mount an immune response. This is what you do when you get a flu shot. By the way, I don't get flu shots because of the allergies. So, but the point, because I have gone through that testing and my physician has dictated, but I get your point, Darby. So when they do inject, for any injection, be it MMR or Hep B, they inject just a CC and a half, and that is enough for the body to mount an immune response. Now, when you leave behind the capsule, in it are the impurities and the toxicities, that small amount, that 10%, 5% that remains, is enough for your body to continue to mount an immune response. And you don't want to be in a situation where your surgery is done incomplete and that residual capsule, the silica in it, will continue to mount that immune response.
And you're in a constant inflammatory situation because of that.
Exactly. So so that's why you said it very well. You don't want to leave any of that behind. So that's why it's critical for the ladies to find the right surgeon who's committing 4 hours, who's taking pictures before and after, and also of the chest wall, above and below of the implant, who is also giving back the implants, the surgeon who has a history and a track record like Dr. Chan and Dr. Feng, who do this religiously and who don't augment and who only explant, and who understand that the cure lies in the entire capsule being removed. And I'll tell you, this is essentially the gist of the conversation right now. So in summary, I will say I'm a big fan of DNT. You know, what's my goal of life, Darby? What's your goal of life? And whoever's listening, to live
I like to help people.
To live to 100 without any visits to the doc, right?
That too.
Right, you know, so to live to 100, 110, hopefully 116, that's the oldest living person, without a visit to the doc. And if you can achieve that without doing the Juvederm, without doing the Botox, you know, without doing the facelift, without disfiguring and potentially infecting, without implants, and we know the implants have been outlawed. They have been taken off the shelf in 92. We know they cause cancer, all these textured implants. And, you know, the list can go on and on, plus the implants that obscure the mammogram that picks up on the breast cancer. So I say to everyone, especially to the ladies and the men who are invited on my group, because I tell them, don't force it on your ladies, because it's not fair that if they don't want it, there've been a nice group of ladies who do not want implants, but it's been dictated by their significant others because they want it. And I say, and that's for that reason, I have men who are more than welcome, and anyone, physicians, whoever it may be, my critics, you know, if they want to join, please see what I have to say, because I'm just sharing my story.
There's so many topics we're talking about that I haven't jumped in on it, but for another day, my strong opinion for another day. But yes, I agree with you. I think that no one should influence you if you don't want that. Absolutely,
be your own boss.
You should stand up for yourself, especially at this point.
Be your own boss.
Dr. Khan, as always, this has been lovely. I only could see you for half of the live, but now I can see us a little bit again. This has been the funniest live because when I'm talking, I can see our conversation, but it's about a 5 to 10 second lag. So this has been such a fun conversation and so much good information. I hope it's going okay for everyone else to see. I hope they can see it good.
Yes. Now, let me just read one question I see from, do you think a lift makes the breast look better after explant? Now, I will tell you what happens is, you know, whenever you have an inflamed tissue because of the peri-prosthetic, i.e. peri-implant inflammation, because you see it down the dilated veins that almost all the patients have, you have most likely below the muscle, sometimes 5-10% of the time above. You have this area where you have in order to do a true lift around the nipple areola all the way down and an anchor. I say the goal of the surgery is what? To remove the implant plus the capsule as one system and block, which I booked my patients for 4 hours, and to get right out of Dodge. That in itself is, in order to do a lift with the right suturing and right mindset, takes 3 hours, right? Because that's a lot of cutting, suturing, and basically immobilizing. 7 hours on the OR table for tissue that's angry and inflamed, that will recede. Now, there was a 69-year-old lady that came. She said, I'm going to get explanted, and do you think I need a lift? I said, 110,000% you need one, because you have no elasticity. You have volume that not only of the implant plus the capsule plus the inflammation swelling that's going to come down. All of that is going to come down. So 100% you're going to be a candidate for a lift. But I say to her right now, if I mobilize and manipulate and move around tissue, and the next thing you know, that falls apart because this is all inflamed, you know what's going to happen. She said, and I get it. Now, guess what? I'm going to offer her the lift if she just chooses to desire to come and get her surgery, because she had no rupture, she had saline implants, and she had what I would say mild to moderate signs symptoms of BII. Now, she said that she came as like a just a consultation to kind of discuss, but she got the message, and she would be a
How long did she have her implants?
Almost 33 years, 30 years or so.
And only mild.
Yeah,
that's amazing.
Yeah. Now I will tell you, sometimes, another lady came. She was a nurse, a cardiac ICU nurse at University of Michigan. Very strong, assertive. She said to me, she came, and I said, I always ask this question, why do you want these removed? And she said, I'm planning on having a baby. And I heard so many bad things about implants. I don't want to potentially breastfeed. And the next thing you know, I could be passing on the toxins, whatnot else. So I just want, and she said, I have zero symptoms. Once I did her explant, she came to me, she's like, my joint is improved, I can see better, my skin is better. And I said, you know what, see, you did not know that, because it masks these conditions, right? And especially when you're in your 30s.
Well, a lot of times we just think it's, we're just aging. A lot of doctors have told many of my patients, including myself, you're just getting old.
Right. When you're 33, you're getting old. When you're 33,
you're getting old.
When you're 33, I tell my patients jokingly, I can throw you from the top of a building and you should be able to make it, because you're 33.
You should still bounce.
Yeah, bounce back very nice and healthy and without any hurt, because that's your young age. When you start touching 40, you start feeling the aches. 50 for sure, especially when you hit menopause. But I'll tell you, nowadays, look at the presidential candidates in their 70s, mid 70s, like Bernie, and all these, Trump.
Don't get me started, Dr. Khan. You keep bringing up all these,
people in their mid 70s are still working the 80, 100 hours. Nowadays, 50s is, very young. People are at their peak of their careers. Many docs that I know at the peak of their careers.
Dr. Khan, you're awesome, and I would love to do another live with you, and I'm sure we're going to have, I always get a flood of questions when we're done. I have to get ready to put my babies to bed, and I see little toes under the door. So I'm surprised no one's knocked on the door yet. But this has been really a great live, super informative, and since it's on your page, please make sure it's public so that I can share it. And if Lori sends it to me, I'll put it on my YouTube page.
Yes. So I actually did it from my own Facebook page. So what I will do is I will have Lori post it such that we can share it with the world. Yeah. Because there's a lot of important points we discussed.
Yes, and I'll put this on my podcast, which is My Crunchy Life, on iTunes and Spotify, and it's crunchy with an IE, all one runoff word, and on my YouTube channel. So I'll put this everywhere so everyone can hear it.
Okay, sounds good. One request that I have from everyone, talk about, why is this movement occurring? Why is there a big change for the better? Because each and every single lady is being assertive. They're coming forward. We're doing more of these lives. The cardiologist that came on and discussed and said, these are the implants till proven otherwise. And we will see, the more we share, the more we write how they were affected negatively by the implants. I will tell you, the more noise, i.e. the more discussions pleasant we have without being unprofessional, meaning we respect everyone. But we say, you know what, the message here is DNT, do not touch. Less is better.
You know what? You know what, Dr. Khan? There are so many movers and shakers and strong warrior women in my group that are standing up for so many things right now. And breast implant illness is another thing that people are trying to hush. And I'll tell you what, we've got some tough women that are making a lot of noise, and I just appreciate them so much.
Yes.
And I really believe because of those brave women making lots of noise, this is why so many things are happening. We had a lot of wonderful women go and protest, and getting the black label on the box. There's a lot of great stuff happening, and there's more coming.
Yes. The black label is a big deal. This is huge on the world of FDA. Basically, a black label means the next level up is a ban. And you know what? We're right around the corner for that, God willing.
Woohoo!
Yeah.
All right, Dr. Khan, virtual high five.
Yes.
We love you. You're awesome.
Thanks.
Bye, everyone who tuned in, and thank you guys so much. And this will be available soon.
Take care. Good night, everyone. Bye-bye.
Bye-bye.